So my name's Dr. Evan Farrer. I'm the co-founder and CEO of Otto. And this evening, we're going to talk about, or this morning, if you're in the US, we're going to talk about, we're going to hear the perspective of my co-founder, Jamil, who is Dr. Jamil Muzaffar, is an ENT surgeon here in the UK, and he's very experienced with tinnitus. So I'm going to ask Jamil a few questions about tinnitus treatment, the research behind tinnitus treatment, which I'm sure you'll be interested to hear about. And then there's going to be an opportunity for you guys to ask Jamil some questions directly. So we'll do our best later on to answer as many questions as possible. I'm sure you've all got lots of questions to ask Jamil. But before that, if you're just joining us, a bit of an introduction to me. So I have tinnitus, and I founded Otto because I saw how difficult it was for people with tinnitus to get access to good quality help. And I'm sure all of you have been told by your doctor, your audiologist, something along the lines of, sorry, you need to learn to live with it. And I saw that firsthand, both personally and professionally, when I was a doctor in the military. And I saw lots of people with tinnitus in the military who really, really struggled to get any kind of help. So I got together with my co-founder, George, and then shortly after Jamil, and we decided to build Otto, the best digital solution to help people manage tinnitus. This was a few years ago. We've made a lot of progress since then. And we'll talk to you a bit later on about how we can help if you're struggling with tinnitus at the moment. So, Jamil, thank you very much for joining us this evening. It would be great if you could introduce yourself and perhaps describe what an ENT consultant, what an ENT surgeon does.
Sure. Okay. Evening. Hi, Ed. Hello, everybody else. I'm Jamil Muzaffar, as Ed said. If you live in the UK, I'm what you would call a consultant ENT surgeon. If you're American, you'd probably describe me as an attending ENT. I'm an otologist, which is a subspecialist of ENT who deals with problems of the ear, predominantly hearing, tinnitus, balance. That's the mainstay of my clinical job. And then outside of that, I'm the Chief Scientific Officer at Otto. And I also work for the NIHR, which is the UK National Institute of Health and Care Research, the equivalent of the US NIH. So that's what I do professionally. My job is a mixture of outpatient clinics where I see people with a variety of ENT problems, often with hearing loss, chronic ear disease, tinnitus, balance problems, things like that, and operating theatre, what I think Americans would call the operating room, where we do operations for ear problems. And then the rest of my time is spent either working on Otto or on clinical research.
Thank you, Jamil. So it sounds like you've got a lot of experience with hearing problems, tinnitus. It'd be great if you could tell us a bit more about your experience with tinnitus and helping people with tinnitus.
Sure. Okay. Well, tinnitus is one of the most, tinnitus is a really common problem. Depending on which study you look at, quite how common it is varies, but probably somewhere between 12 and 15% of the adult population, and actually a significant number of the children's population, but it just isn't a very well recognized problem in children. Often children don't realize there's anything funny that's going on. They just think that's normal. So, it's a common thing that we see in the ENT clinic very regularly. When we see people with tinnitus, there are a number of things that we're thinking about. So lots of the time people with tinnitus are concerned that they might have something awful going on, like a brain tumor, for example. That's actually really uncommon, brain tumors are not very common, and tinnitus isn't a very common way for people with a brain tumor to start showing signs and symptoms of having a problem. But that's often something that they're concerned about. Some types of tinnitus are more concerning for other kind of health problems or for problems that you might investigate and treat in a different way. So for example, if the tinnitus is pulsatile, so it sounds like your heartbeat, that's often from a different source than if it sounds like what people would describe as classical tinnitus, barn door tinnitus, which is normally a buzzing, a ringing, a hissing, a machinery type sound, but not the sound of your heartbeat. And for example, that's investigated with different types of scan, and you're looking for different underlying problems. A lot of tinnitus is related to problems that people have had with their ears. So it's much more common as people's hearing starts to decline with age. And that is also often accompanied by a history of previous exposure to loud sound, often at work for people like Ed who've been in the armed forces, where loud noise is an occupational hazard, but also people who've worked in the construction industry, in factories, in other noisy environments, particularly people who did that before there was so much awareness of environmental noise and where routine hearing protection was typically worn. And then there's people with chronic ear problems, sometimes secondary to their ear surgery, that can develop similar problems.
Yes, it's very clear that tinnitus is can have a wide number of causes. Many things can cause tinnitus. And often when I talk to people with tinnitus, I explain that tinnitus is a symptom of an underlying cause and not a disease in itself. There's usually an underlying thing that's going on that's causing it. And sometimes we do know, sometimes we don't know. So tell us about tinnitus treatment, Jamil. What works in your experience? How do we treat tinnitus?
Okay, so that depends on what kind of impact it's having on the person. So tinnitus is a quality of life problem, not a life or death problem in the overwhelming majority of cases. So the approach to it has to be based on what's right for that person that's come to ask you about their tinnitus. So the most evidence-based treatment, as in the thing with the most research studies to support the fact that it works, is something called cognitive behavioral therapy. So you might have heard of CBT. It's used for a number of other issues, but in tinnitus, the study that really, I guess, put it on the landmark put it on the map, made the landmark study, was a study by a chap called McKenna that was published in the Lancet a few years ago. The Lancet's a very prestigious international healthcare journal, and this was a randomized control trial that showed that CBT was effective. And since then, there have been a number of other studies which have shown that CBT is effective. These are then combined in a scientific approach called a systematic review with a meta-analysis where the results of lots of studies can be pulled together, and these conclude that CBT is not only an effective treatment, but it's the most evidence-based, best treatment. It's not the only thing. Some people benefit from some sound therapy, and that can be in two forms. So for people with tinnitus, often with a hearing loss, they'll benefit from wearing a hearing aid, although there are plenty of people who've got what looks like normal hearing on a hearing test, but who still have tinnitus, and a hearing aid is much less effective for them. And also people often benefit from sound therapy in the form of masking, and that's often sounds that people play that just help to distract them from the sound. So sounds of the sea, sounds of the rain, lots of sounds like that.
Yeah, it's really interesting that, and it's kind of striking that most people with tinnitus are told something along the lines of, or if you read online, there's actually nothing that can be done for tinnitus. But that's clearly not true. Although there's no cure, we do have treatment that is effective for the right person.
Yeah.
Okay. And by the way, guys, if you have, but just before I ask Jamil the next question, if you have any questions, please do put them in the Q&A. This is going to be your opportunity to ask a very experienced tinnitus specialist, ENT surgeon, anything you like about tinnitus, really. So if you do have any questions, please do start writing them in the Q&A box, and we'll get onto these. Jamil, so obviously there's lots of research that shows that CBT is effective. Why does CBT work for tinnitus, or how does it help?
Okay, so we think that the reason that CBT is effective for tinnitus is that CBT is a sort of a shortcut path to something called habituation. So habituation is the idea that something doesn't need to completely disappear for it to no longer cause you a problem. Now, a good example of that is things like if you imagine you move to a new house and the house is near a busy road, and at busy times of the day, there's lots of traffic on the road, and from the inside of your house, you can hear the cars and the trucks going by and making noise. But after a while, your brain sort of tunes out the sound of the traffic. Or the same people who live near a busy railway line, or if sometimes you walk into a room and you hear a loud clock, and then if you don't focus on it, after a while, the ticking sound of the clock is just kind of tuned out by your brain. And we think that CBT, well, we know that CBT works by changing the way that people think about their thoughts and feelings and things in their environment. And it's that cognitive change that improves their perception of their tinnitus. So habituation can be thought of as either the feeling that your tinnitus has gone away, or if it hasn't gone away and you are aware of it some of the time or more of the time, that it doesn't trouble you. So it doesn't elicit the negative reactions that people commonly find associated with their tinnitus, like stress and anxiety and distraction, frustration.
Got it. So it's about kind of changing the brain's reaction to the tinnitus instead of actually changing the tinnitus itself.
Correct.
Right, that makes sense. So I think another example, if I may, and if I ask everyone listening here, when was the last time you noticed your nose at the corner of your vision? And probably most people think, well, not for a long time. If you've got a big nose like me, it's actually like quite big. It takes up quite a lot of my vision, but I never notice it. My brain doesn't pick it up. I don't see it out of the corner of my eye because my brain is habituated to it. So this is something your brain has already done thousands of times before in your life. And it's just another thing you have to teach your brain to do. Is that a good example, do you think, Jamil?
Yeah, it's a great example because and the other reason the nose example is a nice one is that even if you haven't noticed your nose for a while, if you concentrate and look for your nose, you can see it and it is still there. And people who've habituated to tinnitus often find themselves in the same situation, that they haven't thought about the tinnitus for, I don't know, weeks, months, however long it is. Maybe someone else mentions that they've got tinnitus, they think about it. And when they think about it, they do notice that it is still there. Or if someone asks them, they say, oh yeah, I do still hear it, but it's at the back of their mind. It's not at the forefront of their mind, causing them bother.
Absolutely. Yeah. That's, I really like that of, it's, you'll have more days where you become less aware that your tinnitus is there. Okay, so thanks, Jamil, for taking us through that. So we're going to start answering some of your guys' questions. There's some really good questions coming through here. I'm going to kind of go through with order. Anna, I hope that's kind of answered your question. How does CBT actually help? It's about changing your brain's reaction so you stop noticing it, and if you do notice it, it doesn't bother you. So Gemma, thanks for the question. So Gemma, hi, I have pulsatile tinnitus. Can I habituate to this too? So Gemma Jamil has been told that you can't habituate to pulsatile tinnitus. Can you habituate to pulsatile tinnitus, or for that matter, any different kind of tinnitus?
Yeah, so the first caveat to that is if you do have pulsatile tinnitus, you should see your doctor or audiologist and get investigated for it properly, because there are a number of health conditions that can cause pulsatile tinnitus that you may want to have investigated. But assuming that you have already seen somebody and you've been through a proper workup, then yes, people can habituate to pulsatile tinnitus just as they do to classical high-pitched buzzing tinnitus.
Thanks, Jamil. So I hope that's reassuring, Gemma. It's and as Jamil said, it's not the type of tinnitus that's important with habituation. It's all about how you change the reaction that you have. Okay, so there's a question here from Donald. Thanks for the question, Donald. Does it help listening to white noise during the night, or does this make tinnitus worse? So is it okay to use sound therapy techniques at night, or will this hamper habituation?
So yes, lots of people find it helpful to listen to a masking sound, be that white noise, pink noise, the sounds of the rain, the sounds of the sea, lots of those other sounds. They used to often be delivered by something called a sound pillow, which, as it sounds, is a pillow with a speaker in it, essentially. And as you lie on it, it plays some sound that helps to distract you from your tinnitus, helps you to fall asleep. And as long as you don't have the sound level turned up really loud, because any sound turned up too loud can damage your hearing, it's absolutely fine to fall asleep to that. On the subject of which, though, sleep hygiene is really important. There's quite a clear link between poor sleep and tinnitus, both because tinnitus can cause people to sleep poorly, but also people with poor sleep are more likely to have tinnitus. So that's a stressor. Tinnitus is mediated by something called the autonomic nervous system. So you can think of your nervous system as having essentially sort of two parts. One part that lets you do active things like move my arm or speak. And the autonomic nervous system is in control of things that don't require you to think about them. So that's things like your digestion, the control of your blood pressure and things like that. So anything that causes arousal, autonomic arousal, will often make people's tinnitus worse, or their perception of their tinnitus worse. And that's most commonly stress, either a physical stress like going to run a marathon, or psychological stress, problems at work, problems at home, money worries, ill health. And all of those things make people's perception of their tinnitus worse, just in a similar way to treatments like CBT helping to make people's perception of their tinnitus better.
Yeah. Okay. Thanks, Jamil. That's really clear. So there's quite a few questions coming up now, so we're going to do our best to get through all of these. What we're going to do is we're going to answer a few more questions about habituation, CBT. Then there's a few questions, Jamil, that I think you'll be able to provide quite quick answers to that hopefully we can get through quite quickly. But just before we go on to those, there's a question here from Jill. How long does it take to habituate? So Jill's had tinnitus for about a year and is still struggling with things by the sounds of things. I mean, it's still changing quite a lot. So perhaps, Jamil, how long would it take to habituate normally, and then how long would it take to habituate if Jill were to have CBT, for example?
Okay, so that's a really good question, and I'd give you I'd love to tell you it takes exactly 14 weeks or something like that. And the truth is that for different people, the amount of time taken to reach habituation varies. We know from both people that we see in the clinic through our normal, our normal jobs, but also with Otto, we ran a study previously, a research study, where we looked at how long it took people to start seeing benefit from using CBT techniques to try to manage their tinnitus. And in that, I can't remember the exact figures, 80-something% already showed some improvement after 4 weeks. Now, that doesn't mean that 86% of people had no tinnitus at all after that time, but it does mean the way that they felt about it, their perception of it, how their sleep was, how intrusive they found it, those things had improved. So, that's probably a yardstick for, your average punter, but people, some people will be quicker than that, some people will be slower than that.
Yeah, absolutely. So it's kind of how long is a piece of string?
Yeah.
And also depending on the help you get. So, if you can use it, if you can find somewhere to learn, like the digital CBT tools, or if you can get direct help from a specialist, it's gonna shorten the amount of time it takes.
Yeah.
Okay, great. So Ishi's asked a kind of a similar question. How many sessions do we need of CBT to get completely habituated? I'm going to say that's probably similar answer to your previous one. It will depend very much on the person, right?
So depends on the person, depends on how motivated they are, how much they buy into it, think about it, adopt it, take it in. And again, there's some variation. If you look at CBT programs, there's a variable number of sessions that are provided, usually somewhere between 1 and 6, but that depends on a number of factors.
Sure. Okay, thanks, Jamil. So there's a few questions coming in about sounds the normal sounds of everyday life, restaurant, school, a spin class at a gym, is it safe to go to listen to normal sounds, or are these normal sounds going to make tinnitus worse? Do we need to wear earplugs?
Okay, so normal sounds at safe environmental levels shouldn't make your tinnitus worse, although some people do find certain sounds at certain frequencies troubling, and they can either find that uncomfortable, which is something called hyperacusis, which you can think of as the other side of the coin from tinnitus, or they find that it makes their tinnitus worse. And certainly people with tinnitus often report that I went to depending on your age, I went to a restaurant, I went to a nightclub, I did something that was louder than it would normally be. I went to a concert, and that's a classic example that, most of us will have been to a live music event, and, when you leave the venue, you've had your ears ring, and that is tinnitus, and that's caused by overexposure to sound during that live music event. But most of the social things that you're doing would be unlikely to damage your hearing. Though if you are going to something loud, particularly if you already have damaged hearing, then we would encourage people to be extra careful, and that might include wearing ear protection. And certainly if you're going to do loud things like DIY, or if you work as a builder or something like that, spend a lot of time in clinic having to really emphasize to people that it really is important to wear hearing protection.
Got it. Okay, so wear hearing protection if you're going to go to something that you'll know is going to be dangerous levels of noise, but otherwise you don't need to worry. It's not going to make your tinnitus worse. Okay, so Jamil, we're going to do some quick fire questions and then go back to kind of some more CBT related questions. So if you could answer, we'll get through quite a few of these, I think. So if you could answer these in kind of, a sentence or two. So a question from David, is tinnitus related to vitamin B12 deficiency? And are B12 injections helpful for those people that don't properly metabolize B12 tablets?
That's a really good question, and an area where the jury is still somewhat out. There are a number of vitamin deficiencies that can cause the perception of tinnitus. B12 deficiency is relatively unusual in the UK. If you've got a subtherapeutic or you've got a below normal level of B12, then correcting that may improve your perception of your tinnitus, but there are other health reasons that it's a good idea to do that anyway, which actually probably more important than correcting it for your tinnitus. If you have a normal level of B12, taking extra B12 won't improve your tinnitus, or at least there's no scientific reason to expect that. Though B vitamins, if you have them in excess, normally from multivitamins and things like that, they'll just come out in your urine if you've got a bit more on board than you need. So they're not a harmful thing to use.
Great. Okay, and another quick fire question from Joseph. So, are there any studies that link antibiotics to tinnitus, and does this influence the treatment options?
So there are some classes of antibiotics which are particularly known to cause tinnitus. Predominantly a group called, I won't bore you with too much pharmacology, but there's a group of antibiotics called aminoglycosides, which are drugs like gentamicin, neomycin, and drugs like that. If they're given at reasonably high doses, they can damage the part of the inner ear that does balance, the part of the inner ear that does hearing, or both of those. So yes, there are some kinds of antibiotics which can be very damaging to your hearing, and indeed there are other kinds of drugs that can be damaging to your hearing. Some drugs like frusemide, which is a diuretic drug that's often given to people when their kidneys aren't working very well, that can. Drugs like aspirin at very high doses, aspirin overdose can cause tinnitus, although interestingly, when you stop the aspirin, that usually gets better, whereas damage that's come from aminoglycosides, that doesn't. And some kinds of chemotherapy, particularly chemotherapy that includes platinum, so that's things like carboplatin, cisplatin, oxaliplatin, those kinds of chemotherapy are known to be very damaging to, or potentially be very damaging, and to cause tinnitus.
Got it. And Joseph, thanks, Jamil. And I know that the treatment options would, of course, stop after stopping the antibiotics. the treatment options would be the same. Okay, so a question from Emmanuel. Can tinnitus be related to neck and shoulder issues?
Well, it's an interesting question. So anything that's causing you discomfort, be it muscle strain, muscle tension, problems like that, will heighten your sense, your perception of other pain, and could increase your perception of tinnitus, though there isn't an obvious close link. And I've seen no study that suggests, for example, going to a chiropractor would improve your tinnitus. But you know, again, I can't tell you for sure that isn't the case.
Sure. Okay. Thanks, Jamil. Okay, we'll do another quick one here. I'm really sorry. I know there's so many questions, guys. We do these webinars every week, so if we don't get around to your questions, come along to the next one. We have regular guests, you know, with different perspectives of tinnitus, so we will try and get around to them. Yes or no, Jamil? Can sleep apnea trigger tinnitus?
So sleep apnea is a condition where people don't sleep very well, usually due to upper airway obstruction, and that leads to poor quality sleep. Poor quality sleep, as I mentioned before, can be a result of your tinnitus, and poor quality sleep can also make your perception of your life, your health, and your tinnitus worse.
Thank you, Jill. So, okay, thanks, Stefan. Okay, so there's a few here. So David's asked about my personal journey towards successfully habituating. Maybe now that would be a good time to answer this. I'll just give a few minutes. So, David, great question. I'm very happy to share what happened with me. So, when I first started, I've had tinnitus for quite a few years now, but when I first started struggling with it, around 3.5 years, the main problem I had was with sleep. So I'd get into bed, I'd try and go to sleep, and I couldn't because, you know, as you all know, I had this damn ringing noise in my ear, and it would actually make me feel quite anxious, and I would be more anxious about the fact that I would worry about not being able to sleep because my tinnitus was loud, and that actually kind of emphasized the problem, because as Jamil was talking about, the worry about the tinnitus made the tinnitus louder. I was also going through a very stressful period in my life. Fast forward 3 years to now, my tinnitus doesn't bother me at all. I can do this. I can still hear it. If I listen for it, I can hear it, but it's not a problem. It doesn't make me feel like the way it used to make me feel. It doesn't make me feel anxious or frustrated or annoyed. You know, I was lucky. It didn't take me much time to habituate to it. I got the right help, and I'm now at the point where my tinnitus doesn't have an impact on my life. There will be days where I'm stressed, and you know, if I'm having a bad day or I'm tired, I will notice it more, but it doesn't bother me. So, you know, I'm really lucky to have got the right help and when I needed it, but it's no longer a problem for me. So I hope that's kind of some inspiration for you guys that it is possible. And by the way, I've spoken to, and I'm sure Jamil has as well, I've spoken to hundreds of people now with tinnitus, and I've spoken to so many people like me who have got their lives back from this condition. It is possible if you get the right help. Okay, so a few questions here about people that have made good progress with habituation or have started to notice their tinnitus less, but they're getting a bit stuck. Some of these people have been using the Otto app, perhaps, and they're kind of, you know, do they go back to the beginning? They've perhaps not seen a therapist yet. What would you recommend for that kind of thing, Jamil, if you're kind of stuck halfway through habituation and you're not making progress like you were at the beginning?
I mean, it's hard to give individual advice to a question like that. I think it's quite hard to keep my eye on the other screen and watch the chat. I noticed a question about somebody, I think, who'd said that they'd had some tinnitus and then they'd had a further drop in their hearing and they felt that things had got worse. That's not uncommon. If you have a change in your hearing level, usually that would be downwards rather than your hearing suddenly getting better, that often makes people's perception of their tinnitus worse. And that's because when we exist in the normal world, even if we think we're in a fairly quiet environment, there's often a bit of background sound. So, you know, my room's fairly quiet, but you can hear a slight hum from my computer. There's a faint buzz that comes from my light. And these are sounds that are in my environment. And I don't have tinnitus, but if I did, they'd be sounds that might be masking it out. And that's often why people report that when they go to bed at night, they think their tinnitus is louder. The tinnitus isn't actually any louder at night. It's that there's less noise in the environment around them that's drowning it out. So if you imagine you're used to having hearing at this level and, you know, your tinnitus sounds, I don't know, 5 out of 10, and then your hearing falls to this level, then there's less noise in your environment. And even if your tinnitus is only as loud as it was, it will sound louder because you've got less stimulus from the world around you drowning it out. And then, of course, on top of that, you know, I'm sure I don't need to tell anybody that the idea of losing your hearing, like losing your sight, is terrifying and very distressing for people. And in those situations, anything that is stressful like that will often make people's perception of their tinnitus worse, even if they haven't had a change in their hearing. You know, somebody has I don't know, their husband or wife becomes sick, or, you know, they lose their job. You know, those are the kind of things that make people feel that their tinnitus is much worse, or they often do.
Yeah, thanks, Jamil. And I suppose if you're kind of feeling like you're stuck with habituation and you haven't yet tried CBT with a specialist, face-to-face, one-to-one, it's definitely something I'd recommend, and it's something we can help with. We've helped lots of people that have kind of been stuck halfway through their habituation journey. They feel like they've made progress, but they feel like that progress is plateauing, and that's something we can help with as well, which I'll tell you guys more about in a minute. Okay, a few more questions. Question from Catherine. Can CBT training be self-led, or should it be guided by a professional in sessions?
It's a great question. And the answer is that there are lots of different ways of delivering CBT for lots of different conditions, including individual or group, self-directed, or led by a professional. My experience is that most people usually want to see a professional, at least in the beginning, and essentially be given a framework. You know, some of that is around sort of shared experience and a sort of an education around tinnitus, but actually often, you know, the process of CBT is not just about the time that you spend with your therapist or the time that you spend looking at your CBT workbook. It's about changing the way that you think, which is something that you're going to be doing, you know, every day, rather than just the face-to-face contact time or the time that you're spending working on CBT.
Thanks, Jamil. And I was just trying to type some answers to a few of your questions. We've kind of gone through the Q&A section. So, guys, we're going to tell you a bit more about how we can help at Otto, and how we can help you get to habituation. So, we offer a comprehensive program that includes everything you need to get to the point of habituation. So we'll teach you to change your brain's reaction to your tinnitus so that two things happen. The first thing that's going to happen is you're going to stop noticing it. And the second thing that's going to happen is that if you do notice it, it won't bother you, as Jamil's been explaining. And the end result is you've got your life back. You can go back to being you. You can stop worrying about this horrible thing that's feeling like it's taking your life over. You know, we can help with that. So how does it work? Well, this program includes everything you need to get to that point. You'll be working with an expert tinnitus specialist, someone with many, many years of tinnitus CBT, and we'll deliver these cognitive behavioral techniques over Zoom, 2 sessions per month, 45 minutes each. And what you learn with the expert, what you're going through with your tinnitus expert, you'll put into practice using our mobile app. So you can practice all these skills and techniques that you're learning each day and you've always got something to go back to. So you don't need to, you don't need to write anything down. It's all there on your phone in front of you. Okay. So 2 sessions with a tinnitus expert per month. Practice what you're learning with our mobile app, and we'll get you to habituation. We'll get you to that point where your tinnitus is no longer bothering you. So I'm actually just going to show you guys. We have a special offer on at the moment. Bear with me for a second. I don't know if you can see my screen. Okay, so we have a special offer on at the moment. This program normally costs £249 a month, $320 for those of you in the US. But if you sign up today or within the next 48 hours, you'll get 30% off your first month. And I'm going to post the link in the chat, but you can also scan that QR code there. So the code to use is first month 30. Let me just copy and paste that in the chat for you guys. So we'll work with you 2 times 45-minute sessions over Zoom per month. Practice what you're learning in the app. Does anyone have any questions? If you have any questions about the program or how it works, please do fire away. Do fire away in the chat. Oh, sorry, that's not quite the right link. It's the second one. So there's just a question. Sorry, I didn't have your name. Guess my question doesn't fit the brief. So your original question was, I'm sorry we didn't get around to it, by the way. Your original question was, how long does the anxiety with tinnitus typically last? Well, this is all about what habituation is. It's changing that feeling of anxiety and actually perhaps getting rid of that feeling of anxiety. And that's how CBT works, by changing that emotional response you feel to your tinnitus, reducing that emotional response, get rid of that emotional response so you stop noticing it. It sounds like if you have more anxiety than you do tinnitus, and your tinnitus isn't bothering you, then that's probably something I would speak to your doctor about. But if the tinnitus and anxiety are very closely linked. So Alan, how much does it cost USA currency? So it's $320 per month. And after the discount, let me just quickly work that out on my calculator. So after discount, that's $225 per month. So there's a question also about, there's been lots of questions here from Dan. Can you answer all the questions after the webinar is over? How would we see your answers? So I'm afraid we can't answer all the questions after the webinar is over. There's just too many to get through, I'm afraid. But we do have these webinars every week. So you're more than welcome to come again to the next one. We have special guests with multiple different insights to tinnitus. So we've got a CBT specialist coming next week to talk about tinnitus. So please do come along to these webinars in future. They're a great opportunity to get your questions answered. And again, I'm sorry if I haven't answered your questions today. I will try and get through a few more before we finish. So let's go through. Let's just ask if there's a few kind of unrelated questions to CBT. So will hearing aids help me habituate as well as CBT? I have hearing loss in both ears. As Jamil said, the answer to that is yes. If you have hearing loss as well as tinnitus, hearing aids have been shown to help with habituation. Links to long COVID, probably a good one for you, Jamil. Is there any links? Is tinnitus linked to long COVID?
So it's a really interesting question. So tinnitus is incompletely understood, and long COVID is even less well understood. We know that lots of people with COVID can develop tinnitus and have hearing loss. And in fact, I published a paper about a patient we saw with that who had catastrophic hearing loss secondary to COVID. We know that long COVID is associated with high levels of psychological distress, which we know that psychological distress is associated with tinnitus. So whilst it is likely that they may be related, we don't understand what the mechanism of that would be.
Hi, Shamil. Does caffeine affect tinnitus?
So caffeine is a stimulant and increases blood flow. So for some people, they do report that if they have a lot of caffeine, although what a lot is probably related to what you're used to. So if you're somebody that isn't used to having very much caffeine, you have a lot of caffeine, sometimes they report tinnitus. But normally that would resolve when the caffeine washes out of your system.
Thank you, Jamil. And Alan, you said if you have tinnitus for 3 years, is it too late to habituate? Well, I'll take that one if you don't mind, Jamil. Look, Alan, it's never too late to habituate. Okay, as Jamil said, sometimes it just takes longer. For some people, it's just harder. If you haven't spoken to, or if you haven't tried CBT yet, or spoken to a tinnitus specialist yet that can deliver CBT, I would certainly recommend trying that, because it can help to push you from the point of like partial habituation to full habituation. So I definitely recommend getting some CBT if you haven't done already. But no, it's never too late to habituate. Some people, it just takes a bit longer than others. Okay, so we've answered that one. Okay, we've probably got time, Jamil, if we've got another 30 seconds, I think. Will magnesium help with tinnitus?
So there's lots of, there was a question about vitamin B12 earlier, a question about magnesium. For anybody who's got questions about vitamin or mineral deficiencies, the British Tinnitus Association, which is now known as Tinnitus UK, have a really good section on their website, which goes over all of the evidence for different kinds of supplement. And there's loads of them on there, including some of them which are things you probably never have heard of. The short summary is that assuming you have normal levels of those things, and magnesium is generally a very well-regulated chemical within our blood, then taking extra magnesium, there is no good evidence that that would reduce your tinnitus.
Brilliant. Thanks, Jamil. So that's it for tonight, guys. So just remember this, we can help with your tinnitus. We can help you get to habituation with our programs. So be working with an expert 2 times a month. Just as a reminder, this 30% offer, 30% offer for your first month is available for the next 48 hours. If you have any questions at all, you can just send me an email. I'll put my email address in the chat. It's ed@joinauto.com. Please do get in touch. I'd love to speak to you. We're going to run these webinars regularly, so we'll have these on a weekly basis. So you have any questions that we weren't able to answer, please come again next week. And yeah, you know, we can help, guys. So there's a few people that have raised their hands, so I'm actually going to so Jennifer, oh no, you've gone. Jennifer, allow to talk. So I'm just putting you on now, Jennifer, if you wanted to say something. Okay. I think you're still muted, but perhaps next time. So that's just, sorry, that's that. So yeah, please do come again next week. It's been really pleasure talking to you all, and we'll send out the information about the program in a follow-up email. So if you do have any questions, you can just you can reply to that email. Thank you very much, guys. Looking forward to seeing you next week. Oh, Jane. Jane's son worked with you, Jamil, at the QE.
Oh, right. Okay.
Wow.
I think I might know who you are.
Thank you very much, everyone. Thank you very much. Thank you for joining us. We'll see you again next week.